Well, good morning, good morning, good morning. Dr. Peter Holst here. Sorry about that. Dr. Peter Holst here, Middletown Health, Wellness, and Chiropractic. How are you doing today? You have a great weekend. Welcome to Monday morning, August 24th. Monday morning, August 24th, 2020. And I'm here today just to say how grateful I am. I am so grateful for the amount of patients that we're able to serve. We've been getting a bunch of new patients lately, and I couldn't be happier to be able to serve them and to help them overcome what's challenging them in their health and wellness. And in fact, today I'd like to just mention two of those patients. I will keep them anonymous for HIPAA compliance, but I wanted to talk to you first about Sally. Sally came in to see me about a week ago, complaining of low back pain with a nondescript sort of weakness, pain, numbness into her leg, across her butt and into her leg. She had been to the biggest and best. She'd been to Crystal Run, the hospital, gotten injections, gotten medications, and she was literally getting worse. One of her last doctors sent her to a neurosurgeon because they did an MRI and they saw disc bulging in her lower back. And they said, "Oh, there it is. You have a disc bulge, herniation. You need to get it. You need to be cut open and fix that bad boy right there." So she went to a neurosurgeon, and thank God, this neurosurgeon. I hate to say it, was smart enough, but he was wise enough to say, you know what, I can't help you. Your pain is not coming from your disc bulge. You need to go back to the doctor you came from and get stronger medication. Stronger medication. Mask the pain some more. Let it get worse. So that didn't sit well with her, with Sally, and so Sally did a Google search and she found me. And when she came to see me, I almost knew immediately what was going on. She had a sacroiliac issue. Pretty significant sacroiliac issue will look like a disc bulge. It'll look like a disc herniation because it creates that leg symptom. But Sally did not have a disc bulge that was causing her symptoms. She may have had those symptoms, that condition, those disc bulges, but there are so many people walking around nowadays with asymptomatic disc bulges. No pain, just they're there. That's what happens to our back, unfortunately. So what Sally had was a sacroiliac issue, and we got her on a belt. We got her on some adjustments to take the pressure off, the balance of pelvis, take pressure off that sacroiliac joint. We made some pretty significant recommendations for her to avoid continued pain or stress on that sacroiliac joint. And lo and behold, Sally's getting better. She's got a long way to go yet because there's a lot of inflammation. Those sacroiliac joints have a lot of nerve endings, but Sally's a happy camper, and so am I. I take great pleasure in helping patients to overcome painful conditions. And so that was Sally. That's the person. Oh, good morning, Barbara. How are you this morning? Lovely to see you today. And so that was Sally. Sally had a sacroiliac issue that was confounding, or what's the word? Perplexing. There you go. Perplexing her medical doctors, thinking that it was a disc herniation. Boy, when they're there, that's what they hone in on for sure. So if you have one-sided low back pain, right at your belt line, that's causing a nondescript pain into your leg, and doctors are saying that you have a disc issue, run away, run fast, come to my office, and we'll properly diagnose you and treat you. So that's my first patient that I am so grateful to be able to have in my office. The second one came to us about a week ago also. We'll call him Jim. Jim came as a referral from one of his family members who's also a patient here. And he also had been to some of the biggest and best. He was suffering from, his primary concern was his knee pain. He's had a knee pain since an injury while he was in the Navy many years ago. Jim is 34, 35 years old, give or take. and he's been suffering for a while with this knee pain, and every now and again it impacts his back because his altered gait is causing problems in his lower back. And to top it off, Jim is a welder, and what do welders do? They wear that mask, and oftentimes they got their hands full with their stuff, and they got their hood up, and they got to put it down. So what do? They do this. And so I know from long ago when I took an X-ray course with a great Yoakum, Dr. Yoakum, who lived and worked in Wisconsin. They had a lot of shipbuilders back then, and he dealt with a lot of people who were doing that, creating significant neck pain. So Jim had a neck issue that was developing because of his work as a welder, and he had knee pain from his injury in the Navy. And lo and behold, we balanced his pelvis. We took structural pressure off of his knee. We improved the communication between his leg, his knee, and his back. And not only is his back getting better, his knee is the best it's felt in years. Boy, that makes my day. That's what gets me out of bed in the morning, right there. Kind of chokes me up a little bit. So he's doing really good there with his back and his knee, and his neck. His neck is doing real well too. So I'm very appreciative of the patients who come and see me, the people who come to see me for pain relief, to get some answers for their problems. So if that's you, if you have those kinds of issues, and you want a different approach, give us a call. We love the opportunity to evaluate you and give you our opinion as to what's going on. 344-0444, give us a call. Karen will help you and schedule you and get you in the office as soon as we can. And in the meantime, you have an awesome day. Signing out here for Monday, August 24th, and it's a little after 8. All right, so you have a great day. Come back often. We love you, and we'll talk to you soon. Take care.